So, to begin with, the GECAC, Area Agency on Aging in Erie County, was designated in 1974 under the Older Americans Act. The county commissioners at the time for Erie County have designated GECAC to provide these Area Agency on Aging services. I'd like to do a quick history lesson because the Older Americans Act actually stemmed further back in time. In 1935, Social Security was created. And during that time, there were many veterans of Civil War that were in need of social services. So the Social Security was created in 1935. We all know how that has impacted not only our country, but those individuals age 65 and older to be able to have a long-term solution in their retirement years when they're no longer working. Flash forward 30 years, in 1965, the Medicare component and Medicaid components of Social Security Act were created because as people lived longer, they realized that, hey, besides just income and Social Security income, they also need to provide for their health care at that in their older ages. So Medicare and Medicaid was developed in 1965. Medicare and Medicaid are huge programs for the impoverished communities. Realize without Medicaid, which is the low-income component of services for those that don't have the income, that there would potentially be 23% of all Americans rely on that Medicaid provision. So it's a huge program, and that's roughly 74 million low-income Americans and disabled individuals. The Older Americans Act then stemmed from those programs, and basically it was a requirement of the federal government to recognize that older adults need to have their own programs and services at the local level. Focus of Area Agencies on Aging, commonly referred to as AAAs, is local flexibility and community-based solutions, local community-based solutions. There were over 600 Area Agencies on Aging across the country, and GECAC, Area Agency on Aging here in Erie County, is one of those. You can see there that they provide millions of services to older adults age 60 and older throughout the country, including 930,000 caregivers assisted, as well as consultations for long-term care through the Ombudsman program. And I'll be talking about each one of these programs as we go through. In Pennsylvania, there are 52 Area Agencies on Aging across the state that serve the 67 counties in Pennsylvania, and we here in Erie are one of those 52. We are blessed in Pennsylvania to have the Pennsylvania Lottery, which benefits older Pennsylvanians every day. Pennsylvania lottery dollars are a significant source of income that provides these services that I will be talking about that are provided through what's called the Aging Block Grant in Pennsylvania. So the Pennsylvania Lottery dollars give the Area Agencies on Aging a robust network and have ever since the 1970s. GECAC Area Agency on Aging is located here at 18 West 9th Street, headquarters in the city of Erie, PA. We also have locations of senior centers out throughout the Erie County area. First and foremost, I want to highlight some of those things that the Area Agency on Aging at GECAC does. And initially, most of that, through our knowledge of local community resources, is information and assistance to individuals. We want to make sure that every older adult in Erie County knows what services are available to them for their assistance to help meet their needs, whether that's their activities of daily living, dressing, bathing, or whether it's nutritional needs, or whether it's any other support and services those older adults have. Information and assistance is provided through GECAC Area Agency on Aging through our senior helpline. That number is a telephone number, area code 814-459-4581, extension 400, and you will hear me refer to that many times today. That number is key for everyone to get contact to the Area Agency on Aging. Sorry, flipping through this pretty quick here. Let me share a new screen for those that are on the Zoom call meeting so that you can see the services the Area Agency on Aging provide. GECAC, the Great Area Community Action Committee, is very unique in those 52 area agencies on Aging in Pennsylvania because we are also a community action agency. That means we do services to help impoverished individuals and make sure that they can be self-sufficient. You can see here our GECAC webpage and some of the things that we're doing. Before I go further, I did want to touch base. Right now, everybody's attention is focused on COVID-19 and the coronavirus pandemic that we're currently in. GECAC offices are closed to the public at the current time, basically to protect not only the public but staff and help eliminate any more risk of spreading the virus. We're not sure when that reopening date will happen. I know that's probably most people's forethought right now. I do encourage everyone on the Zoom meeting to go ahead and put any comments you have regarding that in the chat function, and we will record those and post a frequently answered questions for any of those comments. I also wanted to make sure that those on the conference call are also able to provide feedback, and you can do that by calling GECAC at 459-459-4581 extension 400 and let the intake workers know that you're leaving feedback on the aging services. So again, I just want to remind everybody that during this COVID virus epidemic that GECAC is still available. We're available through the telephone to assist individuals in need, as well as some of the other programs that we operate that are mandated to continue to operate. That information and referral, getting back to the services through the Area Block grant that we get from Pennsylvania Department of Aging and the Older Americans Act. First and foremost, again, our information and assistance. We will help refer any individual to any services that they may need, including family members. We get a lot of calls from California and outside of the area for older adults who are still living in Erie County. So we can answer those questions for you at any time. One of the primary information and assistance areas we provide is through our PRIZE program. PRIZE program in Pennsylvania is the state health insurance program. It is a Medicare counseling program. So much like I said earlier in the presentation, when Medicare was created in 1965, there are plenty of older adults that rely on that as their health insurance option. There are a lot of choices that individuals have in Medicare, the plans that they have, the Medicare Advantage plans. There's a lot of different, it can get very confusing. GECAC has 15 staff that are trained and counselors to help individually walk someone through their choices for Medicare services. That becomes very important around this time of the year because between October and December is the open annual enrollment period, and PRIZE counselors can do one-on-one counseling. We used to do those face-to-face, and during this pandemic, we'll do those via telephone. Again, you can call GECAC Senior Helpline at area code 814-459-4581, extension 400, and schedule an PRIZE counseling to discuss Medicare options. That is the PRIZE insurance counseling program that GECAC operates here in Erie County under the Area Agency on Aging. Another current, very useful service that's offered right now, we are processing for senior farmers market nutrition vouchers. Senior citizens in Erie and in the Commonwealth of Pennsylvania, age 60 and older, can get vouchers for free fruits and vegetables from local farmers market stands. GECAC, Area Agency on Aging, can process those applications for individuals. And again, you can call GECAC at area code 814-449-4581, extension 400, to start that application process. And we will mail both the application, and once we receive it in process, we can mail you back the vouchers that you can use at local farmers market stands, whether that's at Perry Square or in other local areas. It's a very beneficial program at this time. The other program that is very busy right now is the rent and property tax rebate program. Get to that real quick. That's our advertisement. The rent and property tax rebate is a program of the Pennsylvania Department of Revenue. GECAC will assist consumers to fill out their application, but really individuals can go to the Pennsylvania Department of Revenue website or call them locally and get an application sent to them, either in the mail or via electronically through email. You can call GECAC at area code 814-459-4581, extension 400, and for the rent and property tax rebate, and we will have trained individuals assist you with filling out that application if you feel you need it or you have any questions. And if we can't answer it, we will refer you to the Pennsylvania Department of Aging. So those are some of the areas that our information and referral and assistance program is providing right now. Another key program that area agencies on aging run, and GECAC does the same, is the senior centers, senior community centers. I was saying earlier that not only do we have the 18 West 9th Street Area Agency on Aging, but we also operate senior centers throughout Erie County. We have senior centers in Albion, in Corey. There's one right here at Peach Street, downtown Erie. We have Erie West Center on West 10th Street, or West 8th Street, sorry, as well as the Fairview Northeast Union City Senior Centers. Those all are operated by GECAC, and they basically come out of the lottery funded dollars that GECAC Area Agency on Aging gets each year. It's about $5.5 million worth of lottery funding. And our senior centers are a key component to that. We want to make sure that people have a local area to go to, a local center that they can feel a part of. We like to encourage participants at our GECAC senior centers to be the voice of seniors in that center. Unfortunately, with the COVID pandemic virus, we closed our senior centers again for the safety of older adults. We're working on plans to reopen them, but as the virus continues to put older adults at risk, we are not have a date yet of when those will reopen. And I know it's a large concern as individuals have been isolated, so to speak. Our senior center staff are calling individuals currently to make sure that they have contact and make sure if there's any other needs. One of the other things senior centers provide, not only information and assistance and some preventative workshops such as Arthritis Foundation's Healthy Steps for Older Adults and some other fall prevention programs, but they also provide a daily nutritional benefit through a shared meal called a congregate meal. In those centers, we have roughly 1,600 individuals that take advantage of that each year here in Erie County at not only these 7 senior center sites, but there's also 3 that are not operated by GECAC. One is the Lecom Erie Center for Healthy Aging, which is at 39th and Schaefer Avenue, the Mercy Hilltop Center, which is located on Grandview Avenue, just south of the Mercyhurst University campus, and the JFK John F. Kennedy Jr. Senior Center over on Buffalo Road. Those three senior centers we also support through lottery dollars and funding, and you can also get recreation activities and some of those preventative workshops at those sites when they reopen again with the pandemic virus. Most of those sites are currently closed, but will reopen hopefully very soon. Besides senior centers, I talked about the congregate meal that's provided through those senior centers. There's another way that we at the Area Agency on Aging provide nutritional assistance to individuals, and that's through something called our Options program. There we go. The goal of an area agency on aging is to keep seniors in the least restrictive and most independent environment that senior wishes to be in. That's staying at home, quite frankly. The, the cost of nursing home care can be upwards of $100,000 a year. Not many people not only can afford that, but do not wish to go to leave their home. So to keep individuals, older adults, in their home as long as possible, GECAC uses the Area Agency on Aging lottery funded dollars to provide options program. The options program can supply up to $765 a month worth of services to an individual in their home. One example of that I was about to get into is the nutritional assistance through home delivered meals. GECAC Area Agency on Aging is seeing an increase in our home delivered meals program that we run through our GECAC Meals on Wheels program. The home delivered meals are provided through either volunteers or GECAC staff directly to an individual's home. And those meals are prepared right here at the GECAC's kitchens and some of our senior community center kitchens. GECAC provides that to nearly 500 individuals at the current time, and that is only growing as more individuals stay home with the pandemic virus. You can see there on the screen, if you're on the Zoom meeting, if you're on the conference call, I'll read to you that every year GECAC does about 125,000 meals, both at those senior community centers as well as in the home of participants delivered through our GECAC Meals on Wheels program. So meals is a huge in-home service. Another in-home service that can be provided through the Options program, again, up to the maximum of $765 a month worth of services, is personal care. That's an attendant to come into the home with $765 cap per month worth of services. A lot of times that's only once or twice a week, but they can provide assistance in and out of bath, assistance bathing, dressing, and those types of assistance. It's called personal care. It's hands-on assistance. Basically make sure that you don't fall in the tub or help an older adult to remain in their independent living situation. The other services under the Options program include a safety button, an emergency call button. A lot of people know that as the fallen and can't get up button. That's personal emergency services. It's a response call button that we can put in private residence, and there's a manned toll-free number that's automatically called if you need assistance immediately. That's a great safety net for older adults to remain at home. It also gives a lot of peace of mind to caregivers and family and relatives, especially who are out of town. Other services provided under our Options program include home support. It's kind of like housekeeping chore services. Again, $765 a month maximum. You want to make sure that getting that as sparingly as possible. It can assist with laundry, especially if your laundry is in the basement floor or you have to navigate stairs and you don't feel safe to do that. Home support services can help do those things to keep your environment and your older adult in a safe place for as long as possible. Home health care is also provided again. It's fairly expensive, so with $765 cap of services under the lottery funded options program, can't provide too much home health services, but we can do assistance with medication setup. Registered nurse will come into the home, set up medications for you for the next week or a couple weeks or a month, if they can. And those are all these services. We provide 50,000 hours of in-home services for seniors each year. That's roughly about $2.5 million of the $5.5 million we get each year. So those services are very key and very timely to benefit older adults. One of the other things that is key to know is that $2.5 million that GECAC Area Agency on Aging gets doesn't really stay here at GECAC. We work with approximately 30 subcontracted service providers that go into the home and provide these personal care, home support, and other services. Those providers, home health agencies, are already doing that for Medicaid services and other health plans, as well as private pay. And GECAC options program can provide some lottery support for those services in the home of individuals, which is a very great program that Pennsylvania Department of Aging and the Pennsylvania legislature has earmarked the lottery dollars for. I always use the old adage, Pennsylvania earmarked their lottery dollars for older adults, and every year during Pennsylvania budget, we seem to struggle with providing funding for schools. Florida, when they established their state lottery program, earmarked that lottery funding for schools, and every year they struggle to provide for older adults in their budgets. So the lottery dollars are very lucrative, but we're again blessed that the GECAC Area Agency on Aging has provided those. Pennsylvania has provided lottery dollars for area agencies on aging and older adults. Getting back to the services that are also part of an area agency on aging, we have a domiciliary care program that is private individuals who have an extra room in their house and are willing to take on an individual who needs assistance. Some of these are adults with intellectual disabilities, and some are just adults that need some support. We have a provider network of about 7 or 8 homes that they can take in someone. We assist them, they provide room and board, and GECAC through the lottery funded dollars and the domiciliary care program will help set that up and monitor those domiciliary care program situations so that everybody is safe and providers are able to do everything they need for those individuals in those homes. Another area that we have is a caregiver support program. This is both a federal and state funded program. It is a reimbursement program. So caregiver support, if you're a caregiver caregiving for an older adult, or a grandparent caring for a grandchild 18 or under, you can get reimbursed for those caregiving services if you meet certain eligibility with the income guidelines for the program. Again, you can call GECAC Area Agency on Aging at 814-459-4581, extension 400, to learn more about the caregiver support program and reimbursements. Reimbursements vary with your income level, but roughly around anywhere from a couple hundred to upwards of $500 a month worth of caretaking services that you have to pay for if you're a caregiver can be reimbursed. So you would purchase those items needed to caregive, whether they're supplies or other things needed as a caregiver, and once approved for the program, submit those and we reimburse those under the program guidelines. Very good program, very underutilized. So again, if you're a caregiver and know someone who's a caregiver struggling to pay for the cost of caregiving, please have them call GECAC, area code 814-459-4581, extension 400, and we can assist with that cost of caregiving. That's our caregiver support program. We also, on site, unique to Erie County Area Agency on Aging, have a Home Plus program that puts our care managers on site at Housing Authority of the City of Erie buildings at Schmidt Friendship Apartments. That program has been very beneficial for not only the residents of those things, but also for the Housing Authority and for GECAC. We also work with LECOM to provide supportive nursing services through that program. Very good example of ways that GECAC, Area Agency on Aging, using the $5.5 million we get from the lottery funds, also leverage those dollars to provide more services and more intensive services by combining with the Housing Authority of the City of Erie. Very good program. It's been around for many decades, and from them many decades more, and that's one example. GECAC Area Agency on Aging has about 75 staff, and over half of those, 35 of those staff, are care managers. They have caseloads, and they work with many older adults. Again, we don't go in the homes to provide the service for the most part. That's done through our subcontracted provider network that we pass through those money for, but we just coordinate those services for the most part and make sure that if individuals working with one provider isn't working out, we have, again, the cadre of other 30-some providers we can use. One of the other programs that Area Agencies on Aging are scripted with providing in Pennsylvania is the Ombudsman Program. Ombudsman Program is basically an advocate for those residents of long-term care facilities, whether it's a nursing facility or assisted living or personal care boarding homes. The Ombudsman can take any kind of issues from residents of those facilities and work with not only the individual, the family, or the administration of the living facility to try and resolve those issues. They're very well versed in the rights of residents as well as their income and other things. One specific thing lately with the economic stimulus checks that came out from the pandemic virus in April or May of this year from the federal government, realized that's individuals' own money. That does not need to go to facilities per se, unless the individual directs it that way. So this is one example of some of the rights of residents of long-term care facilities that the Ombudsman can handle. Everything is confidential. It's kind of like a lawyer-client privilege conversation. So any of those conversations that residents have with the Ombudsman can be handled confidentially. Really by the design of the program and by the regulations. So that's the long-term care ombudsman program. Again, if you or a relative have a long-term care facility issues or questions, you can call the ombudsman program at GECAC, area code 814-459-4581, extension 593 or extension 400, and they will refer you to the ombudsman. There are other areas that the GECAC Area Agency on Aging promotes. Sorry about that. That's the foster grandparent program. Low-income older adults who wish to give back to the community can actually assist children in school settings to increase, they become a one-on-one mentor to some of those children in schools and in daycare settings to help them basically learn with their academic progress. Right now, that program is on hold right now because of the current situation with schools and pandemic, but the foster grandparent program is a vital link for multi-generational older adults to connect with younger students. We hear all the time teachers in those classrooms and in the daycare settings are so thankful that the older adult is in there in the classroom with them. It helps keep students focused and respectful of older adults, as well as assist the older adult to give back from their lifelong experiences to the students. Again, that's a foster grandparent program. You can call GECAC at area code 814-459-4581, extension 400. If you're interested in that program, you do have to meet income guidelines because that program provides you a stipend of about $3 an hour of your service, just to defray the costs of being a volunteer. We're looking at that program to go maybe virtually. So that's the foster grandparent program. Another volunteer program that we support to make sure that older adults have opportunities to stay engaged with the community is our retired senior and volunteer program. The retired senior volunteer program, we have over 400 older adult volunteers. That's of any income. They could be low income, they could have a lot of income. We just want their time and to give back to the community. We have 20 some different places that volunteers can go to. They are a key component of providing those home delivered meals that I spoke of earlier. They are also a key component for things in the area of thrift stores, as well as providing supports to some of the food pantries and distribution networks that are out there. Those have continued through the pandemic because of the essential services needed for those nutrition and food delivery. For the most part, our retired senior volunteer program also is on hiatus right now during the pandemic to keep those volunteers as safe as possible. But the retired senior volunteer program provides a lot of volunteer opportunities and encourage anyone who's an older adult that wishes has some time and some life experiences, as the video said, to give back. To call us here at GECAC here today, 814-459-4581, extension 400 can refer you to the retired senior volunteer program for to help give back to the community and provide an opportunity for you to stay engaged. I'm almost wrapping up some of the things that the Area Agency on Aging does here in Erie. We have a couple other big programs that I want to make sure we touch base on. First and foremost is, and unfortunately, one of our most growing programs, we are the Older Adult Protective Services entity in Erie County. That means any issue, anyone that can make a report of need for an older adult, age 60 and older, who may be abused, may be financially exploited, may be neglected, both self-neglect or neglect by a caregiver, and that report will be taken by our trained specialists, and we will investigate and do everything we can to mitigate any circumstances and provide any supports that we can so that older adults are safe in the community. You can call that line 24 hours a day. Again, if you call the GECAC number during the regular business hours, 8:30 and 4:30, you can call 814-459-4581. There will be a prompt if you want to make a report of need, if it's an emergency situation, or any hour of the day or night, 24 hours a day, 7 days a week, 365 days a year. you can call 451-1520. It's like a doctor's office messaging service, and they will get that to one of our trained individuals to find out what's going on. With that service, it's they investigate. They will do a face-to-face with the individual who's a subject of the report. Let them know that someone had concerns about their safety and well-being, and we'll have a lot of resources at our disposal to help those individuals out of in situations, again, of abuse, neglect, or exploitation. Like I said, unfortunately, that is one of our areas that is growing by leaps and bounds, especially as this pandemic and older adults are isolated more and more. It's a big growing concern of ours that there will be older adults facing crisis situations, but we are here to help, and we are increasing that program to be able to handle unfortunately increase in volume in that older adult protective services. You can see there on the screen, for those that are on the Zoom meeting, there are plenty types of abuse: physical abuse, emotional abuse, neglect, sexual abuse, financial exploitation, injuries, weight loss, sudden weight loss, dementia issues, social isolation, which is also increasing because of this pandemic, unusual behaviors or changes in behaviors. Some of those can be simple fixes with getting them proper medication adjustments with medical professionals, and some of them are long-term, may require placement of individuals in a 24-hour care facility. Realize we're there to help not only the individual, but the family and the caregivers to be able to sustain their supports for older adults. So that is Older Adult Protective Services, and again, 24/7, 451-1520. You can leave a message, we'll get right back to you, or they can call GECAC at area code 814-459-4581 during business hours and make reports of need. Anyone can make a report of need on any older adult. I need to shift gears a little bit. That pretty much in a nutshell is a lot of the things we do for the Older Americans Act, Pennsylvania, lottery funded through the Pennsylvania Department of Aging dollars, $5.5 million that we leverage a few more $1 million to provide services to the now their latest data is there's nearly 70,000 older adults in Erie County. That is a lot of individuals who need assistance at any given time. Many of those are healthy and active, and some of them are still continuing to work in the workforce. We can also supply senior community support and employment program for those that want to re-enter the workforce for lower income individuals that need another source of income even in their retirement years. And again, our volunteer programs, retired senior volunteers and foster grandparent programs provide opportunities for some of the 70,000 older adults to get back to the community. One of the other things that an area agency on aging is mandated to do every 4 years is to provide a area plan. We have just finished up our 2016 to 2020 area plan. I will share that on the screen now. So that was our last 4-year plan, which went from 2016 to 2020 for those that are on the Zoom meeting. For those on the conference call, our goals for that plan have been met. They've been ongoing, and we're now looking at 2020 through 2024 area plan. And part of this meeting is to hopefully get some feedback from those of you that are on the call or listening to this video. And again, you can provide feedback by calling GECAC at 814-459-4581, extension 400. I've said that about 30 times already. I'll probably say another 20. And tell them you wish to give feedback for the 4-year plan. They'll jot it down and make sure it gets to us. So our new 4-year plan going through 2024 is really going to be focused on 5 main goals that are also goals of the Pennsylvania Department of aging. They align with national goals through the Administration of Community Living, which oversees the Older Americans Act funding through the Administration on Aging in the federal government. Our goals locally in 2020 to 2024. This is in a draft format, and by September 1st, taking more comments, and we also have done a survey of about 500 individuals locally to get feedback. So goal one is strengthen the aging network's capacity. Like I said, our local capacity has to do with not only the dedicated staff here at the Area Agency on Aging, but also our over 30 subcontracted providers of home health agencies and nursing agencies that we rely on to provide those services in the home of older adults. So our goal is not only to strengthen that capacity, but promote innovation in it, whether that's leveraging technology or ensuring that these reach diverse populations, those with limited English proficiency that speak other languages. We want to make sure we support those and make sure they're aware of the services available. That innovation also includes meeting the diverse community that's out there, getting more diverse out there, LGBT and other consumers that are out there. We want to support and encourage that they also are available to get assistance from the Area Agency on Aging for any assistance they need. We want to ensure that older adults have a better quality of life, and they seek assistance, they get connected to the proper supports. So that's goal one, is that innovation and making sure we adapt to the adapting climate and cultures that are out there and are responsive to that. Goal two is improve services for older adults and advocate for them through evidence-based programming. Evidence-based programming and planning is a key component. We want to make sure that the services and programs we develop are productive, are useful to older adults. We do that in Erie County by being part of many cross-systems entities, networks, and community involvement, so that the community helps us to respond to older adults. This goal two is making sure that we're committed to our own data and outcome quality. That's the quality of the services we provide. So we monitor and analyze all of our programs to make sure that we are hitting what are called ROMA, or Results-Oriented Management Accountability programs. That's pretty unique to GECAC, Area Agency on Aging in Erie County, to utilize those national ROMA and results-driven outcomes for individuals. And it keeps us monitoring our services. GECAC, Area Agency on Aging, is overseen by a board of directors that looks at those monthly, as well as we have an Area Agency on Aging Advisory Council that helps us for very specific services and programs to older adults. The third goal out of 5 goals in our 2020-2024 plan that I want to inform everyone on is prevention services, quite frankly. It's establish and enhance ways to support healthy living, active engagement, and a sense of community for older adults in Erie County. This includes the dementia-friendly environments, making sure that providers can work with individuals with dementia. It's not easy, but you also have to put yourself in the individual's shoes and meet them where they're at. It's a unique skill set that we encourage in all of our providers as well as all of our staff. We want to expand the availability and use of programs that will reduce social isolation, especially now as this pandemic is growing. That's increasing the social isolation seniors have. And we will also, like in goal 1, encourage the use of technology for that, looking at programs for that, especially in these next 4 years. We also want to expand the education of individuals out there, keep older adults informed as well as their family informed on what works, what are good, proven preventative workshops, what's proven to get them nutrition, both in home delivered meals as well as congregate meals for seniors. So that's goal 3, is more of a prevention type area. Goal 4, emphasize a citizen-first culture that provides outreach, embraces diversity, and honors individual choice. Everybody wants to, everybody has the right to live their own life, and the choices they make need to be individualized. We're not going to prescript services. We have eligibility requirements for our different programs, but we want to make sure that we're providing the services that older adults want themselves. So one of the ways we do that is making sure that our services are accessible and as inclusive as possible for all populations, as well as has a variety of access points for individuals to get the information. So besides calling GECAC at 814-459-4581 extension 400 to get any information, we're also part of the Aging and Disabilities Resource Network, which is called the LINK in Pennsylvania. And we work with a number of other agencies to share our services as well as the services that they have available. We want to also provide a person-centered experience for callers, and you'll see that our trained individuals on the helpline do just that. They should ask you what your needs are. They should ask the callers what situations they are trying to overcome, whether that's income or whether that's resources or what that may be, and hopefully be able to refer to answers for those needs. Lastly, it's making sure that people are engaged in that citizenship, making sure that there are meaningful and purposeful volunteer opportunities, which, like I said before, we do through our retired senior volunteer and foster grandparent program, as well as our Medicare counseling has a volunteer component, our ombudsman program has a volunteer component, and all of our senior community centers have opportunities for people to volunteer. Final goal of our 2020-2024 plan for the 70,000 older adults aged 60 and older in Erie County is the goal 5, advocate for the rights of older adults and ensure their safety by raising awareness and responding to incidences of abuse, injury, exploitation, violence, and neglect. This is our older adult protective services, which I said, unfortunately, is a growing area. We get upwards of about 1,500 calls plus per year that we'll go out and investigate. About half of those. Some of those just need a referral for proper supports and services, but about half of those we actually have to go out and investigate, find out what's going on. The issues faced by older adults are from direct physical abuse all the way to financial exploitation, all the way to, like I said before, medication mismanagement, just through no one's fault, just accidentally. So we see a lot. We have a lot of resources at our disposal. We can actually help assist with individuals who need guardianship support and stuff like that. We don't do the guardianship ourselves, but we can assist with that process. So it is a vital and necessary service for those crisis situations that are out there. Again, that's the Older Adult Protective Services, which meets our goal 5 of keeping individuals safe and aware of what services are available. That pretty much in a nutshell is everything that the GECAC Area Agency on Aging does. We are also the agency of last resort. We will do whatever is needed for older adults. So I encourage you to call GECAC at area code 814-459-4581. Our senior helpline, extension 400, can hear any concerns you may have, any feedback you may have on our goals for our 4-year plan, as well as the services we provide through those lottery-funded dollars through the Pennsylvania Department of Aging. And I encourage you to call and give us any feedback you have on not only this plan, but for Area Agency on Aging services in general, One of the things I also wanted to share was our survey of 500 individuals this spring, which we did online, really highlighted Erie is a very good place to be an older adult. There are lots of services. The community is very elder friendly for the most part. 75% of our respondents felt that the Erie community was elder friendly. There's a lot of work to do to make it truly a dementia friendly community. And the area agencies on aging here at GECAC and throughout the state of Pennsylvania are working to ensure that that happens. And we will do so for the next 4 years as per our plan and as per your input to provide us feedback. So thank you everybody for listening to me. I think my throat's about spent, parched. So and thank you for listening to the call. And that concludes our public hearing. Thank you, everyone.